Hi, this is Rudy, Coach Rudy, Nurse Rudy. It's 12:23. I had surgery. I got there late by 6:54, 12 hours ago, and got in there by 7:30 or something like that. And about one or two left. Before surgery time, I got a little story for you. Before surgery time, I saw the lady on the wall was my anesthesiologist, was Miss Pierce or Dr. Pierce. And she came in, and she had an accent. It was kind of cool. And I was like, some Hungarian lady or something. It was cool. And she said, they said, this is your anesthesiologist. My dad always calls me not Dr. Pierce. He always calls me Miss Pierce. I'm like, okay. So when the anesthesiologist said that was her, I went and grabbed her, hug her, and she had stuff in her hand, and I grabbed her butt by accident. I'm like, oh my God, not all of her butt, just one cheek. I'm like, oh my gosh, I'm a butt cheek toucher. So that was crazy when it started off. And then, so I laid up there and got, somebody came and gave me something like Versed or something like that. I was at Baptist Medical at South here in Jacksonville, in the outskirts of Jacksonville. So afterwards, I went under, then I came back, because after they got me an ER, that was a done deal. OR, and that was a done deal. I went in for my surgery with my GI and GU. Gastrointestinal, meaning dealing with the esophagus and the intestines, and gastrourinary, which means they're dealing with the urinary system on the reproductive system. So I got some structures taken out, like some fibroid tumors, and that was done. And I didn't know it was going to, they allotted the time for 4 hours to rent for them to do and be in surgery, and I guess to get out. Well, they got that time down, and Catholic Charities is going to take care of the rest of that, because I am not coming out of my pocket with that. So this story is about, also, I can tell you about my trip too, but this one's going to be about how the lady treated me. Her bedside manner, better bedside manner. Okay, I had a good nurse before I went to sleep. Woke up, I had a bad nurse. The reason why I say she's a bad nurse is she came out, and I guess he asked for some cover from me or something, my significant other, and a drink, and then that was it. And she said something. Somebody said something. I said, oh, that's DRGs. They want me to leave early, DRGs. They said, what is DRGs? I said, diagnostic related groups. And I don't know what she did, but I know she came back. And I went back to sleep. Came back. She came in there, snatched out my IV. I looked to see if that IV was intact, because this is the IV you use to push big fluid. So it's 18 gauge. It was big. I was trying to see if it was intact, and I was like, if this witch had no good bedside manner at all, if something dislodges, it could go to my heart, which would cause my heart to stop, and that would be like a heart attack. Okay, so you can live or die from a heart attack. Even if the surgery was fine, you can live or die from a heart attack because a foolish person just want to be rude and just snatch out your IV. Now, the next thing is, if it dislodge and go to your brain, you could have a CVA, which is called a stroke. And what happens then? With the stroke, you went in there for a simple or a hectic procedure that came out well, and then you come out with a stroke. You can't sue you're not to really sue the doctor. You should be suing that nurse who did what she did. See what I mean? They gonna know about this. I'm writing up on her. The other thing is, and she was covering up her name tag, so nobody will know what her name was. I was so agitated, I couldn't even remember her name because I was still in anesthesia. That agitated. I should have looked at her name 15 million times. I was that agitated. Now, the other thing was, if the tubing that she snatched out did have a piece that came off or stayed in my skin, it can travel also to my lungs. You can get PE, that's pulmonary embolism, which means you could die with blood in your lungs and start suffocating and just die. You can die instantly sometimes, or you can die a couple of hours afterwards, because that blood clot will be in your lungs in a special place you can't breathe. So this is one to say. Baptist South. Some nurses got good bedside manners and some don't. Some shouldn't be acting crazy with others. Really? So, I guess the fact that I'm a nurse upsetted them. Well, it didn't upset them. I should say her. And I'm saying this video to get this message out, you know, to get it off my head so I can heal. Because my auntie had just had surgery as well on some family issue that I'm just going through. But hers, they did her hysterectomy. I went into that. So, and with her, she was mad because they did so many things that was wrong. She's not a nurse. So she really probably don't know exactly everything, but she knew that as a patient, you weren't supposed to do that. And I know I'm taking healthcare administration, which means I govern hospitals as a hospital administrator. And I knew she wasn't supposed to do that. So bad nurse. You gonna get it. Bye. Well, I got to keep up the spirits and release the negativity and let the positive flow so that I can heal better. Because my auntie said once she realized that she was angry with the people at the hospital, she didn't heal. After she realized she was angry, she released it. She healed. So this is my way of releasing on the first day. Boom. And anybody need to know, they can read this video. That way I don't have to keep going and reliving this situ. I'm going to try to let it go. I'm going to tap it out. Tap it out. Tap it out. All kind of stuff. All right. Have a good day. Bye.